No, 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 we can't hear you. Remove the headset now. Use the normal, the way we did it. Like, huh? And so check the mic. There'll be option. You know where it's that mic where it shows that arrow beside the mic. The arrow beside the mic in front of you. Check the below side, below the. You see mic. You see camera. Okay. All right. While you sort that out, let me just engage everyone. Okay. All right. So apologies, everyone. Apologies, everyone. The facilitator for today is having technical difficulties, so we're trying to rectify that now. Um, but that being said, I'm just going to share my screen just to give a quick um, introduction. Okay. Um, okay. All right then. Okay. Thank you all for joining this webinar. We'll still have a lot of people who come through. This is also being recorded, and we can always have everyone access the our YouTube channel from the OHS Nigeria Canadian Interest Group. I'm not so sure if everyone can hear me. If you can hear me, just give a thumbs up so that I'm sure I'm live with you all. A thumbs up, please. Okay, great. Thank you. Thank you for that. Now, okay, great. Thank you. Thank you. All right, great. So we can all hear. That's great. So welcome to the OHS um, Nigerian Canadian Interest Group. And what we have is just let me just give you all the background to the group and more like an history. So this was established, was founded October 2019. The OHS Nigerian Canadian Interest Group was founded at this time. And the initial founder were Oluwatobi Droju and Olumuyiwa Alawi. And then it then metamorphosed to having new leaders, that's Olubumi Alabi and Oluwaseun Taiwo. These were new leaders, and we've had four leaders in terms of the leadership ever since then. Now, what we stand for actually is to promote occupational health and safety standards among Nigerian Canadians, and also to provide a platform for professional development and networking amongst ourselves as a people, or also as a race, and also to support community initiatives and education on OHS practices within the Canadian community. Currently, we have over 136 membership, uh, which is quite a large number because this is strictly a Nigerian Canadian group. Um, but we're increasing. We're increasing. Right now, it's just we're focusing more on safety. There are other components of safety that would also be added over time, like the disability management guys, other specialty groups like human factors and all those other groups will always be added to the group. So for now, it's a growing community for us, and we're proud of that. And our commitment as a group, everyone within the Canadian environment, is that it's a collective effort, right? We are all doing this together. If you know any new immigrant who is in Canada and that needs help, to navigate through the process, um, this is a platform you want to recommend because we share a whole lot of ideas, we share a whole lot of information in this space. Now, that being said, we once again welcome you all to this powerful series. We've been having several of this webinar, and over since last year. And so you can as well go to the YouTube channel. I think Abimbolas, and you have your hand up. Is there any problem, any technical problem? Abimbola Agbi, you have your hands up. Okay, perhaps maybe it's a mistake. If it's not a mistake, just jump in. Feel free to jump in. Okay, there's no for now. There's no fast rule. Okay. So just quick housekeeping. I like what we have right now. For the audios, just make sure you keep your microphone muted, unless when speaking. Then also the video is also optional, but we encourage you to turn it on during discussion. Like I said, this is more like a network, community. So if you're able to place a face on that, and that would be great. Oga Bibola, you are meant to moderate this event, but I have to like give you some space. Okay. Yeah. So this session will be recorded. Um, just so you know. So if you agree to participate in this very webinar, this is recorded. And let's just encourage ourselves to keep the webinar etiquette, which is very important. Be respectful and be cautious to all participants. And we also expect everyone to participate actively in this very webinar because it promises to be very, very interesting. Okay, I'm just going to stop on here and let's see if we have our presenter here yet. Because I believe he's having some challenges, like technical challenges from his side. And I'm just going to stop here, stop presenting. Okay. If I can just crave your indulgence just to check on what's happening from his side. Okay.
It is something very close to my heart, and I'm very happy and excited about the fact that people are getting really interested in it now worldwide. So, just to get started, I would like to introduce myself formally. My name is Sam Akinshiku. I'm one of the occupational health and safety specialists for Government of Alberta. Prior to my current position, I've been opportune to work in construction as environmental health and safety advisor. I also worked in a manufacturing sector as health and safety coordinator, and also I worked in healthcare sector as health and safety manager. More recently, I also work with Regional Health Authority, Fraser Health in BC, as infection prevention and control specialist. My focus at the time was all about, employee health and safety. So before we get started, I would like to have an idea of, our knowledge about workplace biological hazard. So I need some volunteers here. I need a few people to tell us about, your name, the industry you work in, and what's your own take on biological hazard? Are you exposed to it at your work or not? What's your knowledge on that? Anybody? Yeah, if you can monitor that for us, Toby. Yeah.
Yeah, maybe. Hello. Yeah, sorry, I might not be able to put on my video just now, right? Um, well, I believe biological hazards all uh, in our workplaces, maybe because of my background too. I've worked initially as public health inspector back in Nigeria, so I have environmental health background. So, but just like he said, I'm not sure a lot of people are keying this kind of hazard into in the environment. For example, while I was working at safety and health officer with the government of Manitoba, when I go for inspection, right, You see people eating in where they are working,
Yeah.
and where they are working, you have a heap of refuse or some dirt all around the places in the workplace. You know, possible biological hazard can be there, and even in our own workplaces, in offices too. Sometimes we look at the carpet and
Yeah.
rug. Many a time there'll be spill of this, spill of that, and over the time, become moist, right? Which I believe also can, hibernate some biological agent. But I've never seen anybody really talking about it from at least the few time I was around the office at the time. In fact, even in my office, there was a time I had to call the attention of the managers to the urinary. At a point, it was blocked. And one day, 2 days, I was like, what's going on here? Why is anybody not talking about this? And yet we are safety officer and things like this is happening in our office. So yeah, maybe my background also gave me that sentiment anyways, but as safety and officer generally, I really don't see a lot of emphasis in biological hazards, biological safety kind of. Thank you.
That's a very wonderful point. I think, yeah, I totally understand where you're coming from. It is a gap that most people are not talking about, right? And that is one of the reasons that we're having this conversation today. It's time we start talking about it and start connecting the dots when it comes to biological hazard and basic things as very common diseases that we are aware of and the connectiveness of those diseases to workplaces. So thank you for sharing that. Any other one?
All right, thank you very much for this wonderful conversation. My name is Wali Adibuke. Basically, biological hazard is something that is very common in our workplaces. For example, we're talking about the lavatory. Please get out of here. We are talking about the lavatory, the toilet, where our workers, where we use most often, most times, and people come around with different infections that we don't know of.
Yeah.
So from these infections, and workers, and the toilet is a common place that they make use of. So most likely, that is an avenue to talk about biological hazard. Then also during emergency response,
Yeah.
during first aid treatment, when people get caught and the first aiders want to treat them, emotions sometimes set in. And these are one of the things that we saw during the COVID era, where some doctors were emotionally treating patients and they got infected with the infections.
Yeah.
So that is also an aspect of biological hazard. Then our sewages in our various workplaces, leakages in the pipes, our ACs, the Guinea bacteria, and also what was it called? Well, there's this other one now. The kitchen where our workers go to eat, the
Yeah.
dining, and also our waste management processes. When in our waste, where we keep our waste, all those areas too are also very important areas to discuss about. Then our normal general office table setup, there are bacteria all around everywhere, but some are infectious while some are just living their life.
Yeah.
So there's need to carry out risk assessment and to know the effect and to put control measures. That's the little I have to say. Thank you.
Thank you for that. I think you just called the magic word there, risk assessment. I think what we've noticed across board when it comes to like occupational settings and biological hazard is the inadequate risk assessments in terms of evaluating the exposure to biological hazard. So thank you for mentioning that. Thank you. Any other one? Do we have any other one from the chat? Toby.
Hi. All right. Good evening, everyone. Am I audible, please?
Yes.
Okay. I'm going to. I have a background in construction with
Okay.
respect to OHS, and I want to speak with the aspect of design,
Yeah.
especially probably when you are trying to erect a skyscraper and all that. You discover that oftentimes probably the project manager, the site supervisor, the architect, and a whole lot of people usually leave out the safety department when it comes to structural designs and all that. They
Yeah.
only feel that the safety department comes in when, of course, the structural design and everything has been done. Now, this now speaks to where the food handlers stay. For instance, imagine having a cesspool not too far from the kitchenette. It's already a recipe for biological hazards to thrive, as the case may be, because of course, understanding what a cesspool is and where the kitchenette is, you know that people from the smell that emanates from those places and all that, some of them can carry pathogens that are airborne and all that, and transfer them directly into the food that workers eat.
Yeah.
Then the second part I want to speak to is the aspect of the packaging materials themselves. Now, you notice that I don't know if everybody noticed this, but I, for one, before I use a kind of packaging material, either to microwave a food and all that, I usually check the base of the packaging material to read the information that are embedded in it to know if this is suitable for this condition or not. Now, how do biological hazards thrive in this kind of situation? For instance, now you're using a kind of packaging material that is not microwave friendly. It's already written there that this packaging material is not microwave friendly. As a result of what, a lot of reactions can go on between that packaging material, the food inside, and of course the microwave that you're going to use at that time. But trust me, many people don't read this information. So it is not until when the fly perches on it, or when you have your kitchenette close to the cesspool and all that, before these biological hazards could find thriving points where they can actually manifest or corrupt the food that one has to ingest at that point in time. So I also speak with the, like I mentioned, just 2 points: the cesspool not factoring safety designs, especially in construction aspect, and also not considering the kind of packaging material that you're going to use, if it is suitable for that particular function or not. Thank you.
Oh, that's a very wonderful one. I'm really happy to, have this conversation with my colleagues here because it feels good to, have a conversation about things like this with people that are actually doing that work. And you just feel like, you're not trying to convince the laborers, you're not trying to convince the project manager at the time right now. So it's actually interesting to have this conversation with you guys. I think we have some other points in the chat box. I think someone said biological safety, snakes and mosquitoes. Yeah, that's a very good example too. If you work in, um, in in Alberta, for example, we have all those life wildlife conservators and stuff like that that work in those reserves and places like that. They are exposed to snakes and bees like that, which could be vectors for biological hazards. So that's a very good point. And I see snakes here as well. I see bees and stuff like that. You guys are giving us very really good points here. Any other one from the audience? Anybody else that wants to jump in before we go to the next slide? Yeah, raccoon infestation, that's another good one. You see, all those, rodents and all those rodents, for example, they have there's something called antivirus that is always in their feces, right? So when we talk about, you're exposed to them, even the cleaners clean up those feces are exposed to those dust from the feces that are contaminated with antivirus. Those are also biological hazards. So yeah, that's a very good one too. Modes, yeah, that's another one. We're going to talk about modes later on today because it's very common in construction. So we'll definitely talk about that. Any other one before we go forward?
Yeah, good evening. Yeah, my name is Peter Patella. Can you hear me?
Yeah.
Yeah. I work in Lagos in a paint company actually. And one of the new workers exposed themselves to biological hazard is number one, their cloakroom, the place they change their clothes, their work clothes. Those guys that work in the shop floor, salty, paint, chemicals, and when they went to change their work clothes, they expose themselves to chemicals, you discover that some of them still use the same cloth to the next day. So by doing so, they are exposing themselves to biological hazard.
Yeah.
Thank you.
Yeah, that's a very good point. Yeah, when you're taking up PPE, people tend to contaminate, self-contaminate. We call it self-contamination, especially when you're coming from a very dirty environment to a clean area. So you're taking off your PPE. There's high chance of self-contamination when you're doing those things. So yeah, we'll definitely talk about that later on today as well. Okay, I think we have a perfect understanding of, what biological hazard is. I'm excited with this one. Basically, from previous experience on this, this knowledge check, people often find it difficult to conduct the risk assessment to actually connect biological hazard to their workplaces. But I'm glad that we as professionals talking right now, we've been doing that, and it's a good way to start with this. So, I would first like to talk about the International Labour Organization. I'm just going to assume that we all know International Labour Organization. So, International Labour Organization is a branch of United Nations. They basically have 187 member states right now, I believe, if I'm not mistaken. What they do is they look at international labor and occupational health and safety aspect within international labor. So they contact, member states and make some recommendations to member states. They send out questionnaires to member states like Canada, US, most of, the UK, most of the European countries as well. And those member states fill up the questionnaires to, develop some sort of general recommendation when it comes to employer health and safety under LOL. So they did a report in 2022 just after COVID, and the report was basically about biological hazard. It is on their public facing website. So if you're interested in that, you can always Google it. It's called Biological Hazard Technical Guideline by ILO. So you see most of this information there. So one of the things I went through the report in 2022 or 2023, I don't really remember. But yeah, I went through the report, and one of the things that I found from the reports, the issues that is surrounding biological hazard as a workplace hazard. The first thing that I noticed there is the insufficient inspection and compliance with legal provisions. And I think we can all agree that, most of our occupational health and safety regulatory bodies, I would say about occupational health and safety, for example, or WorkSafe BC or OSHA in Ontario, I believe. Yeah, I would say they really don't focus on biological hazard. They do focus on hazard generally, but their understanding of biological hazard is not as deep as what they have in terms of physical hazard or as deep as what they have in terms of chemical hazard. So they are still very lacking when it comes to biological hazard. Hence, that is why they don't really focus on biological hazard. And if they don't focus on it, we as an employer, I'm going to call us employer because we are always representing employers. We as employers, we don't focus on what we are not being cautioned on. So if there is no compliance report on you have to comply with this biological hazard recommendation or best practice guidelines, then we don't work on it. So that's one of the things that ILO also identify. Another thing is under reporting of biological hazard in the workplace. So when you think about, I'm just going to give you guys an example. When you think about a poultry farm, we all know that avian flu is something common in poultry farms right now. Avian flu, the symptoms of exposure to avian flu is similar to the symptoms of exposure to your regular influenza, right? So if you think about a worker with regular influenza symptoms, they tend to automatically admit that, oh, I have a flu. They don't ever think about the possibility of that being avian flu symptoms. That is one of the reasons we don't have enough data when it comes to biological hazard, because people don't report it. People don't report the effect of biological hazard because they can't place it or they can't connect it to work. So that is one of the things that ILO also identified, that okay, we don't have workers reporting that I have flu and it's from my work. People don't say that, right? People rather say I have flu, it's from my kids, it's from the community, it's from every other aspect of public health, but definitely not from work. So That's one of the findings there. Another thing is deficiency in risk assessment. I know one of the some of the people that talked about, their industry or their experience with biological exposure. Yeah, biological hazard exposure. Yeah, they've done some sort of risk assessment on that, but some of us still don't have that knowledge when it comes to that, right? So we still omit it. Most people still believe that if I work in a chemical company, there's no way or form that I'm exposed to biological hazard, but that is not correct. We will go into details of that example later, anyways. And when it comes to workers' compensation, if you look at WCB in Alberta or Worksite BC in BC or WSIB in Ontario, they have a checklist of what they consider exposure to workplace biological hazard. I know for WCB in Alberta, for example, they have specific information with regards to what they cover when it comes to infectious diseases in workplace. So they give industries like healthcare the priorities when it comes to that. So if you're working in a retail store, they will not adjudicate any form of infectious disease in your favor when you work in a retail store because it's not part of their checklist. So I think one of the gaps that we have across board when it comes to workers' compensation board is the knowledge about that as well. Because just because I work in a retail store, I'm also exposed to biological hazard, even from customers, even from ventilation systems in the store, right? So there's all of this exposure pathway that people don't really understand, and I think it's all about all stakeholders need to understand the concept of biological hazard before we can really get something out of it. And lack of health surveillance data. So right now we really don't have any surveillance data in terms of how many numbers of people are calling in sick for avian flu or for regular influenza or for CD or for MRSA and all of those interesting pathogens. We don't have data for that when it comes to workplace health and safety. So that is one of the reasons that we are going to be focusing on it in the future. And the most important part is the inadequate information for OHS professionals, which is us. And that's what we are going to be doing today. We know that, for the most part, most people focus on anything that has to do with biological hazard to be public health issue. They don't think about it as, workplace health and safety. So all us as occupational health and safety professional, except those of us that probably have public health background, are the ones that are able to, adjudicate or the ones that are able to connect the dots when it comes to biological hazard in workplace. I think some of us that are like if you have a background in construction safety, for example, I don't think you will be very proficient in biological hazard unless you have additional sessions like this or you have additional trainings that will give you that knowledge. I think one of the curriculum, I don't think there is any of these institutions, I might be wrong though, but for the most part in Canada, I don't think there's most of these institutions discuss biological hazard in details. I'm very sure they don't at University of New Brunswick. So yeah, that is the findings on ILO report. So focusing on inadequate information for OHS professional, that is our learning outcome today. We as OHS professional, this is going to be an opportunity for us to have an awareness of biological hazard, to have an idea of maybe you're going back to work on Monday, look at your workplace hazard assessment and see, did we even cover anything on biological hazard? It doesn't matter what kind of work you do or what kind of industry you work, there is still opportunity for you to look at potential exposure to biological hazard. So our learning outcome today is to understand biological hazard, including their mode of transmission, infectivity, virulence, as well as how to apply appropriate control measures. So on our agenda, we're going to be defining biological hazard. We'll talk about high risk occupations. We'll talk about biological hazard risk factors. We'll talk about exposure routes. We'll talk about the effect of biological hazard, and we'll talk about the control measures that we have right now based on hierarchy of control. And we'll also talk about the implication of all of this on us as OHS professionals or OHS practice. So if you look at the definition of biological hazard, if you do a little bit of jurisdictional scan across board in Canada, you notice that there is no direct definition for biological hazard on any of the regulations. So if you look at Alberta Occupational Health and Safety Act code and regulation, you will not find any definition for biological hazard. If you look at WorkSafe BC definition for biological hazard, you're not going to see anything on biological hazard. No, I don't think there is any jurisdiction in Canada with a direct definition for biological hazard, except New Brunswick. So New Brunswick has something around biological agents, not directly biological hazard, right? So if we can't define the hazard, it becomes very difficult for us to understand it. So this is where we have to, adopt the ILO definition of biological hazard. So ILO defined biological hazard as, any microorganism, cell, or other organic material that may be of plants, animals, or human origin, including any which have been genetically modified and which can cause to human health. I think that's the most important one there. So we need to understand the fact that it is not just um, animal exposure to animals or something. It's not just exposure to plants. It has a very broad spectrum when it comes to biological hazard, and we're going to talk about that in detail. We're going to give an example of each and every one of the component of this definition: plants, animals, and human origin. So they also concluded with, the inclusion of bacteria, viruses, parasites, fungi, prions, DNA materials, bodily fluid, and other microorganisms associated with allergens and toxins. I think one of the things that I've noticed around, just from my personal experience from biological hazard is sometimes it could be chronic. So exposure to the effect of biological hazard could be acute or chronic, and we're also going to talk about that later on. So I'll share my example with you when we get there. So we're going to talk about the categories of biological hazard right now. So when we think about biological hazard, we think about, infectious diseases and non-infectious diseases. And I think people often use the word contagious as well. So those words are used interchangeably. So it could be contagious diseases or non-contagious diseases. So our focus today is going to be more on, infectious diseases. So when we talk about infectious diseases, we have two groups under infectious diseases. We have the communicable disease and we have the zoonotic disease. So the communicable disease is, think about diseases that can be transmitted from one person to another. So if you have more than one employee at your workplace, there is high chance, there's not high chance, the probability of having exposure to communicable disease right there is 100%. So this is one of the reasons why I said, biological hazard is everywhere. So if you have human, not just one is not just a single worker working in your workplace, you have more than one worker working in the workplace, there's high chance of communicable disease. Okay. So the other part is zoonotic diseases. Zoonotic diseases are those diseases that are transmitted from animals to humans. Okay. So when we talk about zoonotic disease, we talk about avian flu, we talk about rabies, we talk about hepatovirus and all of those ones. And when we talk about communicable diseases, we talk about, your regular flu that we have, seasonal flu that we always have. We talk about COVID, for example. We talk about, tuberculosis. We talk about, I'm just thinking of other, we talk about all respiratory diseases. And we also talk about all gastrointestinal diseases. Those are just the examples of um, um, communicable disease. Do we have any questions so far before I go to the next slide? Toby, are you monitoring the chat box just in case we have questions? Okay. Okay. So now that we know the categories of biological hazard, I think it's very important for us to know that, even though biological hazard is present in all workplaces, we still have high risk occupations. Okay. So we have high risk occupations that, are also highlighted on ILO reports. I think the first one that we have is healthcare industry. So, this one is a very straightforward one because you think about when someone is sick, they go to the hospital or they go to see the doctor or medic center and all of those places. If I'm sick and I'm going to those places, I'm exposing those workers that work in those settings to biological hazard. That's very direct, right? They have direct communication or direct contact with those people. And, if I'm sick, exposing them to it, right? So it is very common there. That is why most of, I think, 87% of biological hazard claim is always from healthcare industry. The other industry that I have here is the emergency responders. So when you think about paramedics, they go to places, where there is, blood and bodily fluid exposure. Perhaps there's an accident somewhere. Perhaps there's a fatality. There's blood everywhere. They are exposed to those things. They have no idea of, what the health condition of the victim of that is. So, but then they still go there to work, right? So they are exposed to those blood and bodily fluid. You think about the police as well, and one of the emergency responder that we all have in our all on our workplace is the first aiders. So this is one thing that we need to be very careful of. The first aiders need to be very careful of blood and bodily fluid as well, right? So those are also high risk occupation because you're giving mouth to mouth to someone BLS or CPR to someone, you're getting yourself exposed to whatever pathogen that person might have, right? Construction. Construction is one of the tricky one that most people are always like, especially I know some of us work, closely with all these, residential construction workers or even industrial construction workers. And they usually say, oh, they don't like us. I know they don't like any health and safety professional. But now think about it when you mention the possibility of them getting exposed to biological hazard, it makes your life difficult. But the main thing is that they are actually exposed to it through the dust, right? So when we think about, dust particles always contain endotoxins, for example. It could contain mold. I think someone mentioned mold earlier on today. It could contain mold as well, right? So when they are exposed to those things can affect their health and safety as well. So yeah, construction is one of the high risk occupation when it comes to health and safety. Another part of construction that is very tricky and also very obvious is the plumbing part of things. So when you work with the plumbers, I had the opportunity to work with in construction with plumbers in the past, and they deal with all these pipes that conveys blood and bodily fluids and stuff like that, and they are actually always exposed to those things and they have no idea. I know they are always like they don't care about it, but you as a professional in health and safety, it is your due diligence to explain why they should be very careful when they work in that sector, why they should have information on biological hazard on their field level hazard assessments or the general hazard assessment. Another industry that we have as high risk occupation is the congregate setting. So when we talk about, long term care facility, when we talk about, the prison, jails, and stuff like that, those congregate settings where people are always there. And when we talk about, homeless shelters and places like that, there is always exposure to pathogen due to how close people work in those places, right? So, and it is very important for us to capture those on our hazard assessment. Another one that is very controversial, especially if you're from Alberta, is agriculture. So when you think about livestock farming, you think about poultry farms, cattle farms, and all of those places, those are living risk when it comes to biological hazard. There are lots of pathogens. I think 75% of the diseases we have as humans today, I'm just quoting the World Health Organization here, 75% of the diseases that we have as humans today are from animals. So they're zoonotic in nature. So people working in the industry that produce animal producing industry, farms and stuff like that are extremely exposed to biological hazard and especially zoonotic diseases. One of the projects I'm working on right now is also around zoonotic diseases in Alberta. So hopefully we'll get something good out of that and I will be able to present on that in the future. Another one that we also don't really talk about is meat processing production and food processing production. So this is a tricky one just based on the report that we have in the past. I don't know if you guys heard about during COVID, one of the first industry that was significantly impacted with COVID infection in Alberta is the meat production plants in southern Alberta, I believe. Yeah. And also in BC as well. So it is a risk that nobody ever thought about, but now we're learning more from it, and we are knowing that that workers are actually exposed to it. Another part to that is that when you process meat and food, there is always living, biological as an example. For example, microorganism thrives very well in when food are in temperature danger zone, which is between 4 degree and 60 degree, I believe. I think so, yeah, between 4 degree and 60 degree. So if food are in that temperature danger zone, there is high chance that microorganism will replicate as fast as possible in that temperature danger zone. And people working in plants where they deal with, packaging meat, packaging beef and stuff like that, packaging, other food items like that are often exposed to that. I think one of the things that they work with in the food processing industry and the meat processing industry is the fact that they have the hazard analysis critical control points, and they're always arguing. I think the argument is that we have these critical control points to prevent the growth of microorganism, but that is geared towards the quality of the meat, right? Not the exposure to workers, right? And that's one of the things that the regulators are going to be focusing on in the future. Any questions on biological hazard high risk occupation before we go to the next slide? Okay, now we're going to talk about the biological hazard risk factor. So virulence is one of the risk factor when it comes to biological hazard. We have survivability and we have the infectivity as well. So virulence, when we talk about virulence, we talk about the aggressiveness or the severity of the pathogen. So sometimes we have some pathogens that you don't need a lot of those pathogens to have effect, to have medical effect. For example, if you think about some pathogens around um, that the farmers, I'm going to say the us farmers, I think they're called us farmers, I don't know their industrial name, but the us farmers, they have a particular pathogen that is highly virulent, so they don't need very much of the virus to affect an individual. They just need a little exposure will blow it away, right? And we also have some that have um, I would say C. diff, for example. C. diff is considered one of the pathogens that can survive on the surface for a very long period of time. And the reason for that is because those pathogens, for example, the C. diff, they survive. I'm talking about the survivability now. They survive on surfaces for a very long period of time based on the fact that they produce spore. They are spore forming bacteria. So even if you try to wipe them up, clean them up, the disinfectant wipe that you're using for them at a particular time is probably not working because they have a specific one that is going to work for them. So they can survive on surfaces for a very long period of time. So that is one of the risk factors for biological hazard. And I think the last one is the infectivity. Infectivity is based on um, how much of a pathogen do you need to get sick or to be affected by it, by exposure to it. Right now, I think it's one of the things that most jurisdictions are working on in terms of we have OEL, which is occupational exposure limits for chemicals, right? But we don't have anything for biological hazard. So we are thinking. I think most regulatory bodies are working around, the OEL for biological hazard, which will give us perfect understanding on the infectivity level of each pathogen. Any questions? Okay. So now let's talk about the biological hazard exposure route. So when we talk about the exposure route, it's about, how will this pathogen move from point A to point B? So let's think about, construction, for example. If you know, HSC for a construction company, and we're doing renovation right now, And we know that the renovation that we're doing is based on the fact that, the drywall was exposed to water and there is high chance of mold growth on that. How will my workers be affected based on that? So for this one, we think about inhalation, right? So it depends on the evasiveness level of what you're doing. So if you're removing drywalls, for example, or you're, demolishing drywall, that is going to generate a lot of dust. Molds will be in those in the dust, for example. So for that part, inhalation will be the exposure route. So other activities like, if you're sweeping in the farm, in a poultry farm, for example, you are also, disturbing, the pathogen from, they are usually settled on the floor, but when you start sweeping, you aerosolize them and they become, aerosolized and people can breathe them in. And that's one of the exposure right for that. And for laboratory procedures as well, when people work in the laboratory, they are also exposed with due to inhalation. Another example, a good example for this one would be like the current situation of COVID pandemic, right? So we have droplets. I think initially when COVID started, people were like, "Oh, COVID is airborne, COVID is droplet." There was a lot of confusion around that, but the concept of it being airborne and droplet is all under inhalation. So you have to breathe it in. So it means the bacteria is out there and we are breathing it in. So if you're working in healthcare, you have a patient that is coughing, for example, and you have a staff that is working there as well. The staff is exposed to that through inhalation. Another route is absorption. So absorption is when you absorb it through your skin or mucous membrane. So when we talk about mucous membrane, we talk about, the opening of your mouth, your nose, eyes, and places like that. So again, I'll refer back to COVID. During COVID, during the exposure to COVID, we talk about, use of mask, especially in healthcare, you use mask, you use, face shield and all of those things to prevent your mucous membrane from exposure. And it's not just about COVID as well. If there is any exposure to, tuberculosis in healthcare, also they recommend the use of adequate PPE, which includes, N95 mask, which includes, face shield, eye goggles, and stuff like that. Injection is one of, the exposure route for contamination as well for biological hazard. For example, you think about, I would use syringe, for example. I will also use um, oh, sorry. I will use example will be something you ingest, something you eat. So I know someone mentioned earlier about the kitchenette of your workplace where you eat contaminated food and stuff like that. When people leave their food for a very long period of time, that becomes contaminated. So when you ingest those things in workplace, an example of this being related to workplace is I had the opportunity to work in a work site camp, and if you work in a worksite camp, for the most part, they always provide, their staff with food in those camps, right? So if those foods are, contaminated and the staff should eat it, they become, exposed to it. And it becomes a workplace hazard at that point because the food was introduced or was offered to them to the workplace. So it is WCB worthy, it is WSIB worthy as well. So those are just the example of how people can be exposed to biological hazard in workplace. Also, if you are offering contaminated water to your employee as well. So let's say, for example, your water dispenser, there's no cleaning schedule for your water dispenser. There's no, there is no cleaning schedule for your water dispenser. There's no access to potable water at your workplace as well. Those are routes for biological hazard exposure. And the last one is injection. Injection is pretty much when you inject yourself directly or indirectly. For example, when your workers step on nail in a construction site. For example, when you work with needles or syringes in healthcare settings, when people self-inject themselves directly or indirectly due to whatever incident that might occur that will cause that. So when there is a direct puncture from a used syringe, for example, as well. So those are the examples of exposure routes when it comes to biological hazard. So just a little bit of global stats. I know we talk about the effect of biological hazard now, but before we go into details of the effect, I want us to have an idea of what is happening globally when it comes to workplace biological hazard. So reports from IOL as well as Australia and Northern Europe, the Scandinavians, they had this report about in 2022 we have about 520 deaths that are related to workplace biological hazard risk. Okay. And out of that, we have 476,000 that are related to communicable diseases at work. And we had about 74,000 deaths caused by non-communicable diseases. So among the 476,000 deaths, we know that COVID was responsible for 223,000 deaths in the workplace. Okay. So when we think about these numbers, we know that, biological hazard is not something that it's something that we need to place more emphasis on. Any questions so far? Okay. So mold is a fungi. So it's usually when we have any I'm trying to think of a perfect example for you. So when we think about construction, for example, and we have a building that there is moisture, and you notice moisture on the ceiling or on the wall, those are signs of mold growth. So mold growth very well when there is, moisture and, the humidity is relatively low. And it's a fungi, like I said, and it can cause a respiratory disease as well. Okay, so it is something that for the most part, it is it affects most people that are immunocompromised for the most part. So for us, if you are not immunocompromised, you might not be able to tell. And I think that's one of the challenge that we have with biological hazard. So most of the demography of people that work in close proximity to biological hazard, they really don't show the health effects of those exposure to the hazard itself. The only time that we have a relatively high report on that is when someone is immunocompromised. I'll give you guys an example. I was working on a case of an employee the other day, and it happens that this person was working around people that are COVID, C. diff positive. So C. diff is a bacterial infection that you can't kill it, right? But it's also present in all human beings, right? But when you are older, it shows is it's more prevalent when you are older. Its symptoms is more visible when you are older, right? So there was this a very young lady, I think 23-year-old lady. She's a nurse and she was working with patients that was C. diff positive. Okay. So at the time, she was exposed to that, but on a normal day, she won't show the symptoms of C. diff, even though she was exposed to it. But due to the fact that she was immunocompromised, she started showing symptoms of C. diff. So this C. diff aggravated the health effects of whatever situation that she was going through, and she was off work for I think about 2 months or thereabout. So those are just the examples of how things can aggravate. So sometimes we might not be able to tell the impact of exposure to biological hazard just because of the demography of the people working. If they are young, they are young, they they have good immune system, they have this in place, they have that in place, and it becomes really hard to understand the effects of biological hazard. That's one of the challenges around it. Okay, so now we're going to talk about the health effect of biological hazard. So it depends on the pathogen, if it's bacteria, virus, or fungi. Mold, like I said, is a fungi. It is one of those pathogens that cause leads to respiratory infection. So when you're exposed to it, when you inhale molds during construction, for example, or when you inhale mold when you're doing renovation, or yeah, when you're doing renovation, there is high chance that you have respiratory infection. Another example of that would be, your pneumonia. Another example would be your um, COVID, for example. Another example would be tuberculosis. Most people that are exposed to tuberculosis are always healthcare workers. Most people that are also exposed to tuberculosis are like law enforcement officers as well. They're always very exposed to tuberculosis. So again, respiratory infection, it affects your respiratory tract starting from your lungs. So basically, when those pathogens when you're exposed to those pathogens, they affect your respiratory tract from, lungs, esophagus, and all the way to your nose and stuff like that. The other one is gastrointestinal problems. So this is when you are exposed to this pathogen, most people say they have foodborne illnesses. That's what they say. They say, you start to vomit, you have nausea and diarrhea and all of those things, dehydration and stuff like that. Example of this will be like I mentioned earlier, with C. diff. And also, we've seen a situation whereby an employee working in a restaurant was exposed to a GI infection based on the fact that they were exposed to E. coli from the meat that they're working on, that they were working on to, make food. Also, people working in water treatment plants are also exposed to E. coli, and stuff like that. People working in child care facility are exposed to C. diff, like I mentioned earlier. They're exposed to norovirus and stuff like that. So C. diff, again, is an example of gastrointestinal problem or infection, which goes directly to your intestine. The one of the issues that we have with biological hazard when it comes to like generalizing them is that they all share the same symptoms. So, for example, your respiratory infection that I mentioned earlier on, the symptoms are the same. They are the same as COVID, they are the same as influenza, they are the same as avian flu. And when you think about the gastrointestinal problem as well, the symptoms are usually the same. They're the same as, vomiting, diarrhea, and stuff like that, eye fever, and stuff like that, getting dehydrated. Again, another industry that are usually exposed to gastrointestinal problem is the construction. Plumbing, for example, they are always exposed to it because there is E. coli, there is E. coli, there is salmonella that they're exposed to during their daily activities. Skin infection. So biological hazards are also responsible for skin infection. As you can see here, we have bacteria like Staphylococcus. We have methylene Staphylococcus aureus that is always, a skin-borne disease that you see on your skin. We have most people that work in healthcare are always exposed to that. Most people that work in congregate settings as well are also exposed to Staphylococcus aureus. In construction, it is not very common, but it is possible. The one that we have in construction that is very common is Candida aureus. Is a very common infection in construction settings. It's also very common in anything that has to do with working outdoor as well. There's always exposure to Candida aureus. Chronic conditions. So exposure to biological hazards could lead to chronic conditions. For example, if you work in in the agri sectors where you are doing some sort of agri feed production, when you think about feed production, they do a lot of grinding of materials, plant-based materials, animal-based materials. They blend those materials together and it generates a lot of dust. So those dust generate endotoxins that leads to chronic health problems. So, for example, a study shows that if you work in agri sector, there is high chance that you are going to have occupational asthma. So occupational asthma is not something that if you're exposed to it today, you just don't get it, right? It is a chronic disease, so it takes a longer time to have effects on you. So biological hazard are also responsible for that. So it's one of the effects of biological hazard, chronic exposures. Another example of that will be, if you are constantly exposed to even all those, E. coli all those salmonella and stuff like that, you're constantly getting exposed to them. It might also lead to a chronic health effect for you. So now that we've talked about, the effects of biological hazard, I think it's very important for us to talk about the control measure. Just like we do with every other workplace hazard, we always like to go with the hierarchy of control, which is elimination, engineering, administrative, and PP. I'm just going to cite some examples of those control measures in this slide. So with the elimination control, when we think about, eliminating the actual hazard, that is what elimination control is about. But it depends on your industry. So if you're working in healthcare and the source of hazard is, your patient that you're working with that is, a COVID patient, the elimination control will be to take out the patient. In healthcare, that is your bona fide work requirements. You have to take care of a sick patient, right? So you can't eliminate when it comes to that. So when it comes to, it's very tricky when it comes to, the type of industry you work in. Elimination control is not always visible in healthcare. However, when you think about, wildlife management and stuff like that, elimination control is very, very, very easy. When you think about, poultry farm where the source of the source of exposure is a vector, let's say rodents or snakes, like someone mentioned earlier, or like bees, we can eliminate those by, using some pesticide and all of those things that will serve as elimination. Another one will be like I said, if it's vector borne, like rodents, in poultry farm, let's say, for example, they have, exposure to migratory birds, the reason for avian flu. So you can take care of those birds by, biologically introducing a species of animal that will take care of the birds, that will kill the birds. Or, for example, if it's rodents, introducing cats to kill the rats, the rodents, and stuff like that. That will be an example of elimination control. So elimination control is just basically removing the source of hazard itself. Again, the only time that elimination control is not applicable is when you are being binded by legislation not to kill a particular vector, for example, or when it's in healthcare that remove you can't remove the source, you can't remove the patient, you have to treat the patient. So elimination control is not always visible in those scenarios. So when we have those scenarios, we think about engineering control. Engineering control is when you create a physical barrier or you do some modification on how to control the hazard itself. So, for example, we'll go back to the healthcare example. When we are, when we introduce um, ventilation system into the resident or patient room. So if you go to most hospitals, you'll see they have a special room that they call negative air pressure room. So that's where they put most of the patients with biological hazard. So the reason they put them in those rooms is that the room is engineering is there is a form of engineering control in place in that room, which is the ventilation system. They have negative air pressure set up in that room at all time. They have HIPAA filter system set up in that room at all time. So that's a good example of engineering control. Engineering control again will be, using a safe engineered syringe. I don't know if you guys are aware of it. There are some syringes that you don't, they when you are not using them, they self retract, right? Another engineering control in construction will be, using all those self retracting knives. When construction workers are cutting stuff, they use lots of knives. They use knives a lot when they do construction, right? So we introduce, self-retracting knives and stuff like that. Those are examples of engineering control. Another good example would be like using, all those sharp containers. I've seen places where they store, syringes, nails in construction in boxes, cardboard boxes. Those are not safe. We want to have those. We also have nails, syringes, and stuff like that, pins and stuff like that in safe engineered containers. Another part of engineering control will be like, when we talk about communicable disease aspect of things, we want to make sure that we reduce the level at which people touch stuff, right? So if you go to the public washroom, like someone mentioned earlier on, laboratory and stuff like that, we want to make sure that there are engineering, there is engineering control in place where they just open themselves based on sensors and stuff like that, auto tap, automatic soap dispenser and stuff like that, automatic door opening and stuff like that, just to eliminate the need of people touching stuff and getting themselves exposed to biological hazard in workplace. Again, engineering control is not always visible in all workplaces, especially when it comes to healthcare. I think healthcare is the most, healthcare and agricultural sectors are the most difficult areas to have both elimination control and engineering control in place. And that's why we have the administrative control. This is where we talk about, having the right policy in place. This is where we talk about having, extensive risk assessments and hazard assessments done and implementing the right control measure. This is where we talk about, providing visual cue to people when they are coming to work. For example, don't come to work when you're sick. For example, if there is exposure in healthcare, providing those signage on the door, providing direction on how to wear your PPE correctly, right? And also informing a plumber about the potential or the possibility of getting exposed to bodily fluid when working on a piping system, or telling an agric worker about the potential of getting exposed to avian flu on site or to all other pathogens that they might be exposed to. So administrative control is what we use for the most part when it comes to healthcare, when it comes to what we think that is most um, is the easiest control to implement when it comes to biological hazard. And of course, we want to talk about the training and policy in place as well. We want to make sure that all employees are aware of the hazard that they're exposed to at work. And we also want to talk about the vaccination part of things, the vaccination type, and when and how to get vaccination are all examples of administrative control when it comes to biological hazard. And of course, the PPE is the last line of defense. We don't want to push this, but what we want to do in terms of biological hazard is to make sure that we combine all the control options that we have. We want to combine engineering, elimination, engineering, administrative, and PPE. PPE is the most tricky one because, is the most tricky and also the easiest one, but we don't want to rely on it because this is not an approach that we want to follow based on the fact that it is individual based and not addressing the hazard itself. The most effective way to address biological hazard is to address the hazard at its source. And PPE is not doing that. PPE is just protecting the employee that are using the PPE, a particular PPE. And there's always limitation to it. So again, we want to make sure that our PPE requirement is captured under our administrative control. So which will include something like, if an employee that is going to be working around someone that is exposed to a biological hazard, if they are not following the PPE requirement, it should be captured under administrative control that might be laid off. They might, there will be repercussion for not following the PPE requirements because, PPE is not the most reliable control when it comes to biological hazard. Well, anyways, we still have to make sure that all employees have the PPE on when they are dealing with biological hazard. We want to talk about the gloves. We want to talk about the mask. So the mask is a very important one because it now depends on the type of pathogen that they are walking around. Again, for the most part, if you're not working in healthcare, um, your regular respirator is fine for the most part because they are Health Canada graded and also NIOSH graded, so they will protect you for most of biological hazard, except biological hazard like tuberculosis. Okay, so when we talk about tuberculosis, there is a special requirement for mask use when it's tuberculosis. We don't expect to see tuberculosis in construction or most of our occupational settings, though. But when we talk about healthcare, we have to focus on that part of things. And when we talk about healthcare, we talk about tuberculosis, we talk about the requirement for N95 mask. So this is where we talk about, the use of N95 mask will always initiate respirative code of practice, which we talk about additional training for N95, N95 fit testing requirement, and all of those things. I'm not going to go into details of that, but it is very important for us to make sure that we know this basic information when it comes to biological hazard and PPE requirement. Another part is the gown. We want to make sure that when we're working around um, biological hazard, especially in congregate settings, in agricultural settings, and in healthcare, there is the need for use of gowns. In construction or oil and gas might not be visible, but in other settings, we need to make sure that if we've identified a biological hazard on our hazard assessment, we need to make sure that we capture the use of gowns, gloves, and glasses or face shield on our PPE requirement. So implication for this, so the implication of biological hazard is just so um it's new. It's not that new, but it's still very new to us in terms of, having to think about it. Now we have to go back to the drawing board, think about, each every one of an employee and how they're exposed to biological hazard, right? So the implication for this is that we have to now develop and implement the process of biological hazard management. So that is one of the things that we as occupational health and safety professionals need to start doing. And we need to also continue to grow our understanding, biological hazard itself, the mode of transmission, the infectivity, virulence, and how we use the appropriate control measure. What I've mentioned today, it is not, this is just a basic introduction to biological hazard. There are lots of pathogens out there. The control measure, the mode of transmission of each pathogen is different. So we need to understand those things one after the other. And it's a very, very, cumbersome thing to work with, but we just have to have this basic idea first. Then we have to start gathering data and doing some research on our own as well. I know sometimes it might be a little, especially if you have, disability management under your portfolio as OHS personnel, then you're telling people to report if they have flu or not, and at the same time you don't want to have that on your workers compensation, right? But for our purpose of having some data to back biological hazard in workplaces up, we need to start getting those data. We need to start gathering the data, getting the reports, incident reports, and stuff like that, and doing our root cause analysis as well. I think it's very important for us to trace back each incident or each illness that a worker is complaining about to a biological hazard and look at the symptoms that they are sharing with you, as well as the symptoms of the biological hazard that they might be exposed to during the course of their job, right? So we want to make sure that we cover all that. Then we want to make sure that we develop, policy and procedures that encompasses biological hazard. Again, biological hazard is just at the at the back end of things, just because of the fact that the effect is health. When we talk about physical hazard, the effect is always safety because we see the effect right away. If someone is should slip and fall at work, breaking bones and stuff like that. We see those things. But the effect of biological hazard, we don't see. So it makes it very difficult. But then we still have to develop policy and procedures that address that. Then we have to make sure that we do a very good job when it comes to risk assessment and hazard identification or hazard assessment as well. Again, what we've learned today from the initial conversation we had is that the fact that most of us have an idea of biological hazard in our workplace, but it is not all about it is not all about us having the idea. It's about us actually explaining those ideas to other stakeholders at our work and making them understand that there is a risk here, as well as there is, the cost on WCB or workers' compensation on it. And we also want to make sure that all managers, supervisor, workers receive appropriate information. We at OHS professional, we might not necessarily have, all the details on biological hazard when it comes to particular pathogen, but I do know that there is public health resources at all the provinces in Canada that we can always refer to. And all those public health resources will highlight the sources of most of the pathogens. So it may be very good for us to take a look at those resources and see, for example, with government of Alberta, you can see some of the resources around, when am I exposed to biological hazard in construction? You can gather some information on that. And of course, we want to look at, when we start talking about PPE, we want to look at, selection of PPE. Are we using the right PPE for this? These are also information that we might not necessarily have answer to, but again, the resources are there for us from public health. We can always consult public health on that. One thing that I want to highlight on this is that during COVID, we know that one thing that we learned from COVID is that, we always say we clean up places, using a particular disinfectant wipe. Those wipes are designed for a specific, pathogen. So sometimes you might see some cells wipe that will say 2 minutes contact time. It kills 75% of pathogens, but that does not necessarily mean it's going to keep the pathogen that you are exposed to at your work. One example of this will be in healthcare. Again, the most common disinfectant wipe that we have would definitely not work for pathogens like C. diff, like Clostridium deficit. It's probably not going to work because, again, like I mentioned earlier, they are spore forming bacteria, so they will never die with basic, um, um, disinfectant wipe. And this is where we have to gather those information from the public health side of things to capture on our risk assessment or hazard assessment to let our employee know that, if you're exposed to C. diff at my work or at our workplace, the fact that we have a disinfectant wipe does not mean you are safe from it. We need to get the disinfectant wipe that is very pathogen specific. Okay, so I think that's one of the gap that we notice generally when it comes to biological hazard in workplace. And the last one is, wearing or applying the right precautionary principle. Again, this is not something that we need to know. We are not public health professional. There's public health resources for us from each province that we can always leverage in terms of, the right PPE, in terms of the right precautionary principle. And you can always reach out to, your provincial representative when it comes to, occupational health and safety, your OHS. In Alberta, we have Ask Occupational Health and Safety that you can reach out to. In BC, they have WorkSafe BC that you can reach out to. I believe in Ontario, you can also reach out to WSIB. I might be wrong, but I think you can reach out to WSIB on that. And for the conclusion, it is very important for us to understand that biological hazards include infective agents such as viruses, bacteria, protozoas, and other microorganisms, as well as animal and plant products. So those are the basic, sources of microorganisms that can cause human that can affect human health generally in other biological hazards. So those again, they all have potential of the risk attached to each biological agent or each pathogen is different, and we need to understand each and every one of them to be able to complete our hazard assessment in workplace effectively. OHS professionals have a key role in ensuring organizational preparedness for biological hazard. Evidently, from COVID again, COVID is an eye opener for us when it comes to biological hazard, and we need to build on what we have right now in terms of exposure to COVID. Again, all workplaces are exposed to biological hazard. It doesn't matter if you are dealing with retail, if you are occupational health and safety professional representing a retail chain, or if you're occupational health and safety professional representing a food production industry, construction industry, healthcare industry, there is always biological hazard in your workplace, and it's time for us to start identifying them and including them on our risk assessment. That is everything that I have for you guys today. I don't know if we have questions or explanation that people will want me to go over again.
Okay, can everybody hear me?
Yes.
Yes, we can hear you.
Um, so I just want to thank the leadership. I want to thank the team for this great event, that comes in every month. I wish we can have this kind of knowledge sharing every day. Great presentation, on these biological hazards. Fantastic. I mean, you check all the boxes for me. You've covered some really important points within a very short span of time. I mean, we need to just internalize all those training and start unpacking them in our day-to-day, events. I also appreciate the depth of your discussion. Just when you were talking about the hazards, I like to highlight, based on my own experience in construction, the risk associated with needle stick injury.
Yeah.
It's not only peculiar to healthcare alone. I remember working on a site, and my workplace at the time, we do a lot of restoration, underpinning and all that. So we would renovate existing sites, especially historical sites, and these are places where you would potentially, see like drug activities in that environment before we would do sites preparation. So, and you would expect my team to go pick up after, those drug people. So you would, um, there are potential of discarded, you would see discarded syringes, and there are potential of having blood-borne pathogen, transmitted to other people, especially in construction sites. I just wanted to highlight the fact that it's not peculiar to healthcare alone, but our team in construction should be aware of this. My advice would be, because unfortunately we don't prioritize this risk, especially in construction safety, and it poses a serious health threat.
Yeah.
Somebody was nearly, because I had somebody being, had his blood, he had his syringe piercing him, and we did a test, and he was lucky because in my head I was just thinking, hepatitis B, hepatitis C, HIV. I was thinking a lot of things in my head. But when the result came and it was free, I was the best. I was like the most happy person at that point. So from the health and safety standpoint, I want to advise our colleagues here present, include this in your risk matrices if you don't have.
Yeah.
And also implement control in line with what has been shared. And if you, Sam did a fantastic job, identifying the risk and hazard and also implementing controls. You can reach out to him if you need help. We're also willing to share. Thank you, guys.
Yeah, thank you for that. And for some reason my presentation, my computer went off, but I can just speak, right? I don't know, something is wrong with this computer. Jesus. Anyways, yeah, that's a very valid point. I also worked in construction sites where we are, there's sometimes that we are exposed to things that is not part of our job. Like you rightly said, if you are working in construction and we have, some of these people that are drug users in that vicinity, we might be exposed to that, right? We might be exposed to all those, syringes and stuff that they use, and also nails as well that we use within, construction site as well. I know it's a very dynamic industry, construction, because what you did in the morning is probably not what you're going to do in the afternoon. So there's always things changing, right? And that's why we need to make sure that we have a process in place in terms of nail management, needle stick injuries management, and stuff like that. So yeah, that's a very good point that you raised with construction. I think.
Yes. Sorry, I log in with my other browser, so I didn't know that's why you are seeing Wesley. My So just to add a little face to my name. My name is Bamidele Oni. I am in Winnipeg, right, Manitoba. Okay. So, well, thank you for your presentation. And Yeah, it's very resourceful and yeah, more an eye opener. However, my direction of thought on this will be a little different, and it's going to be like I'm going to put another poster to horse. Like this vanguard of biological hazard slash safety in the balance of operational health and safety. How are we going to handle the professional rivalry that will come up in the process of this? And what do I mean is that when I was with the government of Manitoba, we have operational hygiene department or unit.
Yeah.
We have operational health and safety officers, and we have the investigation department separately. So most of the operational hygienists actually do things in respect to mold, asbestos, noise, and all those things that are other environmental or public health inclined. So it is basically what they do.
Yeah.
And so if there's any concern from the safety and health officer, you are possibly expected to refer right to that unit to handle it. On the other hand, we have public health inspectors.
Yeah.
And you see the dimension of some of the things that we have opened up. They also carry out inspection, and which I believe, of course, everywhere there is a shortage of staff to be able to cover the massive challenges that is all over in public health and even in safety. So, and also looking at their own dimension with their own regulations and legislation that support what they do. So,
Yeah.
most of some of these things that you have discussed actually might bring us to cross paths
Yeah.
with a public health inspector in line with even the issue of mold is mostly, yeah, we have some part of it in safety that we also look at, but they have a lot to do based on the provision of Public Health Act that they
Yeah.
used in carrying out their duties. So in this vanguard of raising awareness among the safety and health officer, how do we, or let me say you, the vanguard ahead, how do you manage, right, the context of this professional rivalry? Like I talking about biological hazard definition the other time, which I believe in the Public Health Act, they have some of those definitions clearly stated rather than in the Safety and Health
Yeah.
Workplace Safety and Health Act. So how do you navigate this professional terrain? In this part of the world, a lot of this specialization, legal things,
Yeah. Yeah.
all that. You got my point?
Yeah. That's a
All right.
very good. That's a
Thank
very
you,
good
everyone,
question.
for this presentation. Yeah.
That's Thank you for that. That's a very good point that you raised. So what we need to understand here is that for public health, they don't care about the workers. So if public health is going to inspect a building, for example, there needs to be people residing in that building. Okay, there needs to be people residing in that building. That's their jurisdiction. So they are protecting the public. However, for OH&S, we are focusing on the workers doing that work. So it's a two-way thing. I'll give you guys an example. So just think about, uh, when if you think about an employee working in a child care facility, for example, where there is an outbreak of E. coli, for example, and by default, by Public Health Act, they have to be there. That is their jurisdiction. They are protecting the public health and safety of the kids and general public. They are trying to contain that particular outbreak from spreading. They are trying to contain that particular hazard from spreading out, right? But for us at occupational health and safety, we are thinking about the workers. Okay, we are focusing only on the workers. So how is this worker exposed? What is the interest? Our interest is all about the worker, and I think like you rightly said, there's the overlap. There's a lot of overlap when it comes to public health and occupational health and safety. And I think the only time we struggle with that is when we don't focus on the fact that occupational health and safety is all about the occupation, the act of doing that job. while public health is every other thing outside of occupational health and safety. And they are two different jurisdictions. You can argue that with any public health professional. Sometimes we do use their recommendation because, you know, if their recommendation is focused on humans and the workers are also part of the humans, but that does not reduce our importance in terms of, like, what we are able to recommend as well as health and safety professionals. And I think I've had a lot of cases like that as well, when we had to, you know create a fine line to, to delineate the jurisdictional differences between us and public health.
Thank you so much for this presentation. Sorry, I won't be able to a video. I just wanted to ask, where does biosafety come in all this? Biosafety, and what can you recommend how we can just get some, little competence training, just get some extra training in this? It's a very wide field, like you said, but just wanted to ask those two questions on
So,
biosafety, and then where you can get some little competency training on biosafety or biological hazards, just to get going
So
forward with that.
that's a good question. It depends on your industry. I think the first thing is to understand your industry, right? For some of the high risk industries, they have some sort of training guidelines and stuff in place. And like the previous person said about public health, if you look at if you work in food processing industry, meat processing industry, and all of that, CFIA, Canadian Food Inspection Agency, will probably be a good place to start. They have biosafety training. They have biosafety checklists that can help you as well. They have all this information readily available for you. If you work in, healthcare and other places like childcare, hospitals, long-term care facilities, and all of that, you can check your local health authority. They have lots of resources on that. I know with um, Saskatchewan, I think I saw something about Saskatchewan occupational health and safety and biological hazard, stroke, infection prevention and control in workplaces. So that's another good way to start. If you're in BC, there is an infection prevention and control page on their web WorkSafe BC site. I think they kind of like highlight. They have a program, like a textbook, I will call it, that you can download, and you see what your industry is, what you're exposed to in your industry, and how you can update your hazard assessments to include those things. And they also have exposure control plan. A template of all those things are also available. In Ontario, there is Public Health Ontario. Public Health Ontario has done a very good job with infection prevention and control, which is one of the great part of biological hazard in workplaces. They have courses on that too for all workers. They have additional resources like checklists for inspection and all of those things to check you know readiness of biological hazard in your workplace and all of those things. So in Alberta, we have lots of resources around respiratory diseases in workplaces. We are also working on additional resources for people in terms of publications that gives this information and makes it readily available. Some safety association do have information as well. So if you go to Continuing Care Safety Association in Alberta, for example, they have information on biology, specifically on biological hazard and infection control. I think in BC as well, they have some of those things in place as well. So there are lots of opportunities. There are a lot of things that are being done right now just to like create some sort of awareness. What I'm seeing as the future state right now is that ILO will get the member state recommendation and you know harmonize things just the same way that they've done with women's, right? So they are going to create biological hazard safety data sheet. I think there is something like that actually with the government of Canada. There's something like that, public health safety data sheet that you can check. But it is going to be a thing eventually, and it's going to be, I think with that they are going to come up with a lot of resources as well that you can always leverage. But yeah, if you have any question outside of that, specifically to a particular industry, you can always reach out to me. I will try to provide or put you in the right direction to the best of my knowledge.
Very much.
Yeah, yeah. Yeah. Oh, that's a very good question. So I believe with from all jurisdiction, regardless of whatever part of Canada you are, there is always a requirement to follow the manufacturer spec on all of the regulatory bodies information. I mean, the regulations and code like we have in Alberta. So there's always like a requirement for an employer to ensure that your workers are following manufacturer spec. This include things like disinfectant wipe as well. So, for example, if you are looking at COVID, for example, there's a particular disinfectant wipe that will affect that will deactivate COVID, right? So it is the responsibility of the employer to ensure that they make provisions for that particular wipe that is going to deactivate COVID to be available, right? And I know for the most part of this part of things, it is indirectly our responsibility as OHS professional to educate the employer in terms of this is the type of stuff you need to buy. Because if you are buying a disinfectant wipe that is meant for a viral infection, for a bacterial infection, they are never going to work. And your employee they might still be exposed to the same pathogen that you are trying to protect them from because the wipe that you're using is not the right one, right? So again, if an inspector or HNS inspector can come on site and look at that, stuff like that, I don't know, it could be something that will warrant, some sort of penalties, administrative penalties or OHS compliance or whatever compliance tool that they are going to use on that. So it is the responsibility of the employer and also us to make sure that we have the right information when it comes to the right disinfectant wipes that needs to be used for a particular pathogen. And again, for us, we might also still have to leverage, public health information. The resources are always there. And the most of those wipes as well, you can always check Health Canada database. There's something called DIN number. So these are designated numbers for chemical that are supposed to deactivate. So when you talk about your hand rub sanitizer, your cleaning agents, your disinfectant wipes, they all should have a DIN number. So you can always check the Health Canada database and see what the claim is for that particular wipe or ABHR or chemical for disinfection. So there's always information online that you can check.